Hello everyone. Today let's start with pharmacokinetics. In simple terms, it is about what the body does to the drug. Pharmacokinetics is the quantitative study of drug movement in, through, and out of the body. It includes absorption, distribution, binding or storage, biotransformation, and excretion of the drug. The overall pharmacokinetic process is shown in this figure. Here you can see the absorption, distribution, storage, biotransformation, and excretion of the drug. Now let's learn these processes in detail. All pharmacokinetic processes involve transport of the drug across the biological membranes, where biological membrane is a bilayer which is about 100 Armstrong thick and made up of phospholipid and cholesterol molecules. These biological membranes are highly dynamic structures. Drugs are transported across these membranes by passive diffusion and filtration or by specialized transport. In passive diffusion, the drug diffuses across the membrane in the direction of its concentration gradient. The membrane does not play an active role in the process. Passive diffusion is suitable for lipid-soluble drugs, and for non-lipid soluble drugs, filtration occurs. Filtration is the passage of drug through aqueous pores in the membrane or through the paracellular spaces. Let's talk about specialized transport. This can be with the help of carrier or by vesicular transport. In case of carrier transport, there are transmembrane proteins which serve as carriers or transporters for physiologically important ions. Here, the poorly diffusible substrate is in higher concentration. Hence, the SLC, that is solute carrier transporter protein, help them to pass through the membrane. And in case of vesicular transport, endocytosis or exocytosis occurs. A binding protein located on the membrane complexes with the substance and initiates vesicle formation. Now, let's talk about absorption. Absorption is movement of the drug from its site of administration into the circulation. Not only the fraction of administered dose that gets absorbed, but also the rate of absorption is important. There are different factors which affect absorption. They are aqueous solubility, concentration of drug, area of absorbing surface, vascularity of absorbing surface, and route of drug administration. For routes of drug administration, watch my previous video on pharmacology. The link is in the description. Now, let's move towards bioavailability. Bioavailability refers to the rate and extent of absorption of a drug from a dosage form administered by any route, as determined by its concentration time curve in blood or by its excretion in the urine. This is the plasma concentration time curve. Bioavailability differences between three formulations of a drug containing the same amount. Here, the formulation B is more slowly absorbed than A. B may not produce therapeutic effect after a single dose. However, average blood level may be similar with both A and B formulation, whereas C is absorbed to a lesser extent, resulting in lower bioavailability. Now, let's learn about distribution of the drug in the body. Once a drug has gained access to the bloodstream, it gets distributed to other tissues that initially had no drug. The extent of distribution of a drug and its pattern of tissue distribution depends on its lipid solubility, ionization at physiological pH, extent of binding to plasma and tissue proteins, presence of tissue-specific transporters, differences in regional blood flow. Movement of drug proceeds until an equilibrium is established between unbound drug in the plasma and the tissue fluid. Now, here comes a new term called apparent volume of distribution or V, which is calculated as dose administered in IV to that of the plasma concentration. Let's take an example. Suppose 1000 mg of a drug is administered in the body in the form of IV, and it produces the steady state plasma concentration of 50 mg per liter. Then the apparent volume of distribution comes to be 20 liter. This 20 liter is the volume that would accommodate all the drug in the body if the concentration throughout was same as in the plasma. Hope you all have understand this. So this is the table about some drugs concentrated in the tissues. See you all in the next video, which will be about metabolism and excretion of the drug. Till then, take care, stay safe, like, share and subscribe to my channel. Thank you.